Hi, it's Dr. Robert Brueck coming to you again with another segment, What's New in Cosmetic Surgery. You know, many of you may have questions about cosmetic surgery, procedures, new technology you've heard about. If you'd like me to address it on What's New in Cosmetic Surgery, feel free to contact me. Go to my website, Beauty by Brueck, leave me a message, or email me at rjbrueck, B-R-U-E-C-K, at abody, B-O-D-Y, and andface.com. Don't forget to put the A in front of a body. It's very important because I won't get it. So one thing I want to talk to you about today is a little bit about tummy tucks. Now, one of the problems with tummy tucks potentially post-op is the development of a seroma. Now, what is a seroma? A seroma is a collection of fluid. It can occur if, for example, somebody's too active in the immediate post-op period, and that collection of fluid can cause the flap itself to go ahead and separate from the muscles. It can lead to secondary infection. Sometimes can even lead to reoperation. Well, one of the newest advances, well, it's not new like yesterday, but it's been around a while, and that is the use of tissue adhesives. It certainly is a very good thing when we're dealing with children in the ER to be able to take their laceration, put a little tissue adhesive glue, if you will, Elmer's glue, put it together, and voila, no stitches, no needles, no injection. So there was a study done where they took people randomly that were having tummy tucks. Some of them they used tissue adhesive to hold the flap down and then stitched it. In others they did the conventional way. And what they found was the incidence of seroma really was not significantly different. However, the amount of fluid that the patient developed or produced was markedly diminished. So more work needs to be done, because generally when a person develops a seroma, what we do is we aspirate out the fluid, and sometimes this has to be done several times, and sometimes an occasion, and I can't recall the last time I've had to do it, you may have to reoperate. So tissue adhesives may have a part to play, but more work needs to be done. Another thing that I found interesting was a new wound closure system, and it's called Insorb, I-N-S-O-R-B. It was recently FDA approved. And what they did was they used the Insorb system in closing large incisions. For example, breast reduction, tummy tuck. And two things they compared. One, the quality of the scar with the Insorb system versus conventional closure. And two, the time it took to close the wound. The quality of the scar was pretty much the same. So it wasn't better, it wasn't worse, it was about the same. But what was significantly different was the fact that in a breast reduction, the closure was 7 times faster with the Insorb system, and in the case of a tummy tuck, 7.5 times. And this is significant because what it does is it lessens the patient's anesthetic time. The longer a person is asleep, the greater the complication morbidity rate is. So if there's something that we can do to minimize that time when the patient is sedated or anesthetized, it really helps in the post-op recovery phase. So we're going to check into this more and see what's about the system availability. It's very popular in Europe, and now it's starting to come to the States. So you may hear more about that later. Third thing I would want to talk to you a little bit about, and I really never thought about it, and that had to do with the effect of Botox on muscles. Many years ago, as many of you know, I did not utilize Botox. I wasn't convinced it was safe, but now that we have multiple systems, I realize Botox is safe. But what happens is some people are now using Botox to sculpt the face. For example, this is a masseter muscle. Many times people have active enlarged masseter muscle, and it gives them a square jaw. So plastic surgeons will inject Botox into the muscle. The net result is the muscle is denervated. In other words, it doesn't contract, and it atrophies. And that was one of the big problems I had early on with Botox. When you're using it to go ahead and inactivate the corrugator muscles that create frowning, if those muscles atrophy, are you going to get indentation? Well, they were actually able to contour people's face by taking away the innervation to the muscles through the use of Botox. For example, in calves, I didn't realize some people are getting their calves injected with Botox because they have large, heavy, full calves, and they want to have slender, more graceful, if you will, calves. What's also interesting is that once the Botox is completed, and if you don't re-inject, then the muscle will return pretty much to its normal state. So it is not a permanent reduction in the muscle. Another interesting fact is that they found in these long-term studies that people that got repeated injections of Botox, that many times the time frame between injections lengthened. In other words, you got more bang for your dollar, if you will, the more often you got the Botox injection. So I thought that was kind of interesting. It seems like every time you turn around, people are developing new methodologies, new ways to go ahead and utilize Botox. Well, this is one of them, and I thought it was kind of interesting. Another thing, I read an article, I guess it was about trends in cosmetic surgery. You know, there's trends all the time. Thick lips are in, big lips are in, whatever. But it had to do with breast aug. And what this commentator said was that a breast aug is sort of like a fashion accessory. Women have jewelry and belts and wigs and all these different things. And this one looked at it as a fashion accessory. And what they did was they looked at studies, for example, in England. Now in England, the look that women were looking for was a big, busty look, a big look with big cleavage. Whereas an ABC News poll not too long ago showed that in America, breast implant sizes are diminishing. They're going down in size. So that big implants are not in the way smaller implants are. And I think it's trending. It's just like with clothes. One time bell-bottom trousers may be in, then they're not. Then there's a straight, narrow look, then it's the broad-based look. So implants, and I never thought of it, are kind of like a fashion accessory. So right now, I can say in my practice, the majority of women are 3 to 350 in size as far as implants go. But in talking about size, it's important to understand the limitations that the surgeon has, because I can't take a gallon of milk and put it into a quart container. So many times, the size of your chest, the extensibility of the tissues will help dictate size. But I thought it was kind of interesting that some people are looking at breast augmentation as a fashion accessory. Another thing I want to talk a little bit about, buttock lifts. It's one of the trending procedures now in plastic surgery. The year-to-year gain in percentage of numbers we perform is going up tremendously, and it's a very, very popular procedure. And again, I think it's based on where you live. For example, in Miami, it's very popular. In Maine, it probably isn't as popular because beach time there is limited. But what they found was they did a study of 106 patients. 103 out of 106 women who had a buttock lift with autologous fat were very satisfied with their buttock lift. Now, some people get a buttock lift with implants. I don't do implants, but I do autologous fat. Now in this study, the average amount of fat injected per side was about 180 to 840 cc's of fat. One of the problems I found in my patient population is that when people come in for a buttock lift, I think it's a great procedure. I call it a 2-for-1. So you're putting fat where you want it, i.e. your buttock, and taking it from an area where you don't want it, i.e. your stomach, your flanks, your inner thighs, your saddlebags, whatever. But one of the problems is people have to be realistic in how much fat can be put in. Limiting factors include, one, the recipient site. In other words, how much laxity is there in the buttock, how big is the buttock, how much fat can it actually take. Secondly, the availability of donor sites. I think that is the biggest problem I see with some people coming in that want a big buttock but have very limited donor sites. Because you understand one thing, I can't go to Home Depot and buy a pound of fat to inject. I have to take it from you in one way or another and utilize it to augment the buttock. But it's also important to understand that when you're harvesting fat from one area of the body, got to be very, very careful that where you harvest it from isn't going to look worse than what it was before. So you just have to make sure that you do it in a prudent and safe way. But by and large, I think it's a great procedure. Women enjoy it, and it's a one way to enhance the shape of the buttock. What's interesting is the ideal measurement between waist and buttock is about 0.7. So your buttock hip area is bigger than your waist, and the waist is about 0.7 times that diameter, that circumference. So it's kind of the ideal. But again, everybody has their own definition of ideal. One of the things that I read recently and I thought was kind of interesting is, have you ever thought about what is the effect of the breast implant when it's put in your chest on the amount of breast tissue overlying it? Now, in this article, they took about 30 patients and they measured the volume of breast tissue before, shortly after implantation, and then I think at 3 months and 6 months. And what they found was that about 20-25% of the breast tissue will atrophy. Now, I have to say, in my experience, and I've done hundreds over the years, I haven't done three-dimensional tissue measurements, but that has not been the case for me. And there are some people that question the methodology of how they did it, but it's kind of interesting. And it also may lead to the fact that it's one of the reasons I don't use high-profile implant. Because if you have a pocket and the implant's in there and you have a high-profile implant putting pressure on the overlying breast tissue, it could cause some atrophy potentially. But what I have seen over the years, people that have had a breast aug, they come in maybe 5, 6, 7 years later, and they're concerned that their implant is leaking. And I can assure you, if it's a silicone implant, it won't be leaking. If it's saline, it could leak, and if it does, you'll know it. But I tell patients, your implant isn't leaking. But what's happening is the breast tissue over the implant is shrinking. Not necessarily because of pressure, but because of aging. So if you were to look at a woman's breast at 20, 40, 60, and 80, the breast volume will diminish. Look at someone's face. If you look at the face at 20, 40, 60, 80, people lose soft tissue, they get atrophy of the soft tissue. That's a normal process of aging. So I think for a lot of these women, it's not that they are shrinking or leaking from their implant, it's that the overlying breast tissue is diminishing in size. So it's kind of interesting. You may want to, if you've had an implant put in, you might want to think back 5 years ago, 10 years ago, and you may have experienced the same phenomena. But I think that's just all part of the normal aging process, and it's food for thought. So again, I want to say thank you for spending some time with us. I hope you found this informative. Again, if you want to contact us, you can go to my website, Beauty by Brueck. You can call us at 239-244-2329 if you want to schedule a complimentary consultation, and we can discuss issues pertaining to you and your self-image in your body. Again, if you want me to address something that you're curious about as far as aesthetics or cosmetic surgery is concerned, contact me through the website or actually email me at rjbrueck@abodyandface.com. Again, I have an office in Cape Coral. I have one in Punta Gorda. And the number is 239-244-2329. Again, I want to wish you a wonderful week, a great week, and the richest of God's blessings to you and your family always. Take care, and thank you again.